When her infant daughter Reagan was diagnosed with RSV, Sanford Health pharmacist Kristen Gruis learned how superior the care is at Sanford Health in Worthington, Minnesota.
I have full confidence in being in Worthington, and I definitely wasn't scared at all to stay.
In between this past Christmas and New Year's, Gruis brought Reagan in to see Dr. Judith Chavarria for what she thought was an ear infection.
She ended up having double ear infections and was diagnosed with RSV at that time.
RSV typically presents as a cold, but in children it can be much more serious. The infection can move to the lungs, turning the infection into a severe respiratory disease. What's worse is treatment options for RSV can be limited.
We basically have some type of antibodies for premature babies, but we don't have vaccines for that.
The good news was at the time of this visit, Reagan's oxygen levels looked good, so she was sent back home.
So we thought maybe she's getting over the hump of it.
The bad news was a few days later, she still wasn't improving.
On Monday, we saw Dr. Chavarria in clinic, and we ended up being admitted to the hospital later that day.
She was admitted. She was very ill. We have to do high oxygen and for a few days.
Because RSV treatment options like oxygen, IV fluids, and Tylenol are supportive and not specific, Gruis and Dr. Chavarria, in a sense, played a waiting game until Reagan got better. Thankfully, they didn't have to wait long. After a few days, she started to make the mend. Gruis, who has 2 other children besides Reagan, was thankful to receive care in Worthington.
And we wanted to be close to them too and be able to be here for them too if we could. You know, one of us stayed at the hospital, one of us went with the other kids.
She and Dr. Chavarria said wherever you're at within the Sanford footprint, you're going to get great care.
That's an advantage, because if this would be a community hospital that we have to communicate with other hospitals and other clinics and other names, so, you know, like we are part of Sanford system, so it's so simple. We recognize and then we transfer, if that is the case, right on time, no at the last minute.
In Worthington, Simon Floss, Sanford Health News.